platform Swiss Liver Patients Association, Swiss HEPA. Today with the presentation of Dr. Susana Gomes Rodrigues, consultant hepatologist at the Inselspital in Bern. Today about the topic alcohol and liver. Welcome, Dr. Susana Gomes Rodrigues.
Thank you very much, Ms. Bobson, for this kind invitation. I'm very happy to speak about the topic of alcohol and the liver and alcohol-related liver disease. The first question is, how big a problem is alcohol consumption? Well, I think you can clearly see on this map here on the right side that it is certainly a problem, and definitely a problem in Europe. As we see, most countries in Europe either have the highest degree of alcohol consumption per capita or the second highest, which is where we find Switzerland. And according to the World Health Association, harmful alcohol consumption actually represents about almost 6% of all deaths worldwide, which is certainly a very preponderant number. Now, this is one of the first questions that most of my patients ask me, is there a safe alcohol level? The answer, happily for most, is yes, there is a safe alcohol level. Of course, if you have an alcohol liver disease, it's another answer. So if we talk about general public, there is a safe amount of alcohol if you do not have any liver disease. And for most people, moderate alcohol consumption will not lead to an alcohol-related disease. For women, this is usually considered 20 grams of alcohol per day. That's more or less 2 glasses of wine. And for men, it's 30 grams per day, which is 3 glasses of wine per day. That means if you drink up to this amount or less, you should be secure. You won't develop an alcohol-related disease. And the second point, as we see below, is heavy episodic or just heavy alcohol consumption, which is defined with over 60 grams of alcohol consumption in one occasion or every day. And when you have this very heavy alcohol consumption, the risk to develop a liver an alcohol-related associated disease is extremely high. It increases exponentially with the amount of alcohol that one drinks. A very important topic today is binge drinking. We see that in the last 10 to 15 years, pattern of alcohol consumption, particularly in younger people, that means teenagers, adolescents, or young adults, has certainly changed over the years. And there has been an increased tendency for binge drinking. What is binge drinking? Binge drinking is the consumption of more than 4 or more alcoholic drinks for women or more than 5 for men in a 2-hour period. So that means huge amounts of alcohol in a short period of time. People with alcohol-induced liver diseases and those with liver cirrhosis, regardless of the cause, should completely avoid alcohol consumption 100%. Now, why is the liver important? And what is the liver for? And what effect does it have? What effect does alcohol have on the body? Well, the liver is known to have hundreds of functions. The most important known are that it filters toxins from blood, it helps with the digestion of food, regulates blood sugar and cholesterol levels, also albumin production, and helps fight against infections and diseases. The liver is a very resistant organ, and it's able to regenerate itself. It's something that differs, for example, from the kidney or from the heart. And it's important to know that every time your liver needs to filter alcohol, some of liver cells, called hepatocytes, do die. The liver can produce new cells, but continued prolonged alcohol abuse, that means drinking too much over the amount that I previously described, over many years, can reduce its capacity to regenerate. This can lead to severe and permanent damage to the liver. Drinking too much alcohol, either all at once, which is referred to as binge drinking, or drinking too much over time, can seriously affect your health and well-being, and not just your liver health. In fact, besides damaging the liver, the alcohol can have an effect on many other parts of the body. It can reduce psychologically, it can cause mood changes, behavior changes, it can cause digestive problems, malnutrition, weight loss, and can also weaken your immune system. And also a very relevant point is that alcohol consumption increases your risk of developing certain types of cancer, such as colon cancer, of course, liver cancer, esophageal cancer, mouth cancer, and in women, breast cancer. And so that's a question I get a lot of times from my patients is, why do I don't drink all that much? Why do I have a liver disease? And for example, my neighbor that drinks probably more than me doesn't have any problems. Well, unfortunately, health is not just. And so we also know that in liver disease, some people are more sensitive to developing that. For example, those who maybe have genetic changes. There are certain mutations that are associated with the risk of development of of liver disease in general and alcohol-associated liver disease. We know that obesity or being overweight is an added factor which contributes to fatty liver and an added factor that contributes to liver fibrosis or liver cirrhosis. We know that women are more susceptible to the negative effects compared to men. And we know that also certain ethnic groups are also more susceptible to liver disease. And without a doubt, malnutrition is a very important risk factor for liver disease. We know very clearly that patients who only drink and do not eat have a much increased risk of developing liver complications compared to those who eat appropriately. Now, overall, there are known to be 3 stages of alcohol-related liver disease. In an early stage, we have something called alcoholic fatty liver disease. And here, consumption of large amounts of alcohol, even for a few days, can already start to lead to some fat accumulation. What's positive about it is that, one, it rarely causes symptoms, positive or negative. If you look at it in one spectrum, it's positive because the patients don't feel bad. On the negative side, it means that there's damage being created over time that the patient is not aware of. Thankfully, at this stage, liver disease is reversible, and it's been known that even 2 weeks of alcohol abstinence can return liver values to normal. Now, here in the center, we have what is considered one of the most deadliest complications of liver disease, which is something called alcoholic hepatitis or alcoholic steatohepatitis. And this is usually a potentially serious disease that's caused by alcohol abuse, very heavy drinking over a long period of time. Many times it's associated with binge drinking alcoholic hepatitis. The liver damage associated with mild alcoholic is reversible. Unfortunately, by severe alcoholic hepatitis, it is a serious and life-threatening disease. And in many cases, especially in the younger group, I would say people between 30 and 50, it's the first alarm sign that they have that they even have a liver disease. And then finally, we have the last stage, which is alcohol-related liver cirrhosis. Here, it's clearly a stage where there's already scarring in the liver, and when it's in an uncompensated state, that means that the patients don't actually have any obvious symptoms of liver disease, even though they do have a cirrhosis. It was generally thought that it was completely irreversible. Nowadays, we know that when liver cirrhosis is diagnosed, still in an early stage, when patients maintain alcohol abstinence, there can be a regression of the level of scarring in the liver. Unfortunately, if patients continue to drink, the risk of developing a more advanced or decompensated liver cirrhosis with complications such as bleeding, such as water in the belly, such as confusion, and of course, increased risk of liver cancer can develop. And of course, here the risk of death is much higher. And how can we diagnose specifically an alcohol-related liver disease? Well, the first thing is definitely patients speaking personal history with the patient. And here it's very important that we leave our patients very relaxed and open to speak about this topic, which is generally more or less a taboo topic in our society. It's important here that we explain to the patients that this is just a part of our history in a liver clinic to ask the patients how much they do drink. It's not any kind of intrusion on their personal life. So when I first ask a patient how much they drink, and I see that there's an overconsume or an alcohol misuse, what sometimes I do is I can either apply a scale and ask them specific questions to see how high this alcohol abuse is. And of course, we can also detect from laboratory and from other exams if there are already signs of a liver disease. For example, blood tests, we see there's a typical pattern where we see an azat that is more or increased 2 times, for example, what is the alat, or by patients with increased gamma GT values. When we see patients with low platelet count, this can already be a sign of portal hypertension or cirrhosis. Now, we do have specific tests that we use when we want to see if there's been a recent alcohol consumption. These tests are CDT and ETG that can be tested either in urine in the case of ETG or blood in the case of CDT. FibroScan is another measure that we use, another device that measures liver elasticity or liver stiffness. FibroScan. Okay. So besides liver tests, we also have, for example, FibroScan. The FibroScan, as we see here, it's this white device here on the right, is a device that measures liver stiffness or liver elasticity and gives us an estimated value of the amount of liver fibrosis or scarring that there is in the liver. This is one of the first tests we perform in patients with alcohol-related liver disease, and it's very informative. When we see values above 7 kilopascals, that tells us already that possibly there's probably already significant scarring in the liver. And what about liver biopsy? Liver biopsy is performed in cases where we want to specifically diagnose the cause of liver disease if there's doubt, or also if we want to determine the degree of fibrosis or liver scarring. And of course, it's here on the bottom, one of our first exams in the clinic when we want to diagnose liver disease is ultrasound, which already can show us if the patient has liver fat or if there are already signs of liver cirrhosis. Now, what are the complications? Why is it important to talk about alcohol-related disease? Well, because unfortunately, the complications associated with an advanced cirrhosis or an alcohol-related liver disease can be very serious. Particularly, they include liver diseases. As a consequence, they can develop portal hypertension. Portal hypertension is increased blood pressure in the portal vein, which is the vein that drains blood into the liver. The complications of portal hypertension, which come as a consequence to liver cirrhosis, are fluid accumulation in the abdominal cavity, as we see here in the first picture. This is called ascites. Bleeding from veins in the esophagus or the stomach, which are called varices. Increased spleens, coma or mental confusion called hepatic encephalopathy, renal failure, liver cancer, or also infections. Now, what is the treatment for alcohol-related liver disease? The first step is always one: absolute abstinence. If you have been diagnosed with an alcohol-related liver disease, the most important you can do for yourself is stop drinking. And of course, we're there as your specialist, but this needs to be something that's multidisciplinary, and we are there to treat the liver disease and also to help with the other aspects of the disease, which many times have a psychological or social component when we're talking about alcohol-related liver disease. Abstinence is important for the patient to know that abstinence is the only way to possibly reverse liver damage, or in more advanced cases, to prevent them from getting worse. Now, how is the treatment? I want to focus your eyes perhaps in this lower image here. It is definitely, number one, a multidisciplinary approach. That means that we have many different approaches for alcohol-related liver disease, and it should include psychologists, psychiatrists, addiction specialists, hepatologists, nutritionists, and people who also have alcohol dependency, people who have been through the same thing that patients with alcohol liver disease have and can speak openly about it. So the first step is to recognize you have a problem with alcohol. Recognize when, for example, your family doctor, your general practitioner has already told you that there are signs that you might have a liver disease. And we ask that you consider this and seek the help of specialists, either psychologists or psychiatrists, or, if necessary, liver specialists, hepatologists. And if you're physically dependent on alcohol, it is important to be part of something called a withdrawal program. The withdrawal program, generally in the first week or 3 or 4 weeks, is something that's inpatient performed and that helps with, of course, maintaining abstinence. And later on is something that you should maintain in an outpatient setting. Unfortunately, when suddenly there's a rapid drop in alcohol levels, you can develop symptoms from withdrawal such as anxiety, restlessness, hallucinations, and seizures. And that's why it's very important that you seek doctor's help before taking this step. And specifically, what can we do to treat an alcohol-related liver disease, especially in the more advanced stage? In a more advanced stage, generally, malnutrition is very frequent. So we generally seek the help of nutritionists, and many times we ask patients to take these kind of protein drinks because they help increase the calorie intake and improve their general well-being. Specific medication. Well, naturally, there's medication that's given to treat the complications of liver disease and portal hypertension. But specifically, when we're talking about alcoholic hepatitis, which is this very large inflammation in the body and the liver that can occur, generally the treatment, first-line treatment is prednisolone, so it's steroid therapy to reduce inflammation. And then we say is probably the last line of therapy is liver transplantation. And for more advanced alcoholic cirrhosis, meaning stages where patients have already had complications of portal hypertension, this may be the only treatment option. But it is important for people to know that in most centers, active alcohol consumed is a contraindication by many. And many centers, it's necessary to have 6 months of abstinence. Fortunately, nowadays, the thought behind this is changing, and many centers are quickly adapting to new data showing that, of course, in the setting that patients have completely desire stopping to drink and have support from family and social support, this 6-month rule is not so strict as it used to be. But in any case, there needs to be a willingness from the patient to stop drinking before even considering liver transplantation. And so what I'd like to finish is telling you that you are not alone. And if you have issues with alcohol, and specifically with alcohol liver disease, please seek the help of specialists. Even the first line is your general practitioner, seeking the help of a psychologist. And if there is signs of liver disease, seek the help of a hepatologist, a specialist in liver disease. Thank you.
Thank you to Dr. Gomes Rodrigues. And as you said, together we are stronger. Thank you very much for the important and information and exciting presentation. And thank you also for your great personal commitment. Thank you very much, Dr. Gomes Rodrigues.
Thank you. It was a pleasure.